Dr. Sanjay Jadhav. Dr. Jadhav is very talented and versatile personality. He is MBBS and MS in general surgery. He has done Indian Trade Services of Government of India. He is MBA and postgraduate diploma in export operations from Indian Institute of Foreign Trade. He has a few of the MS in the respective fields. So I'll just list that out. He is MA in philosophy, MA in history, MA in economics, and MA in English literature. Dr. Jadhav started his career as surgeon and as associate professor of surgery at Lady Hardinge Medical College, New Delhi. Doctor was selected in civil services in 1989 batch and worked with Ministry of Commerce as assistant and then Deputy Director General of Foreign Trade at Delhi, Mumbai, and Goa. Dr. Jadhav joined private sector in 1996 and currently working as Chief Executive Officer for Silkland Group of Businesses in Dubai since 1996. Besides the academic qualifications and his career, Doctor also studies Upanishads and has conducted discourses on Kathopanishad, Isha Vyasopanishad, and Kenopanishad, and is currently having a discourse on Patanjali's Yoga Sutra.
Ashtanga Pranam to Nikam Guruji, the most selfless that he has exhibited through Ambika Yoga Kutir. Humble pranams to this and all his colleagues. I feel more than privileged to talk about yoga, modern medicine, yoga and modern medicine. With God's grace, I have been on both the sides. I do not claim expertise of either of them. However, for a comparative analysis and to place the exact placement vis-a-vis each other, yoga and modern medicine, I want to, which are not mine. When it comes to yoga, they are from the ancient tradition of India. And when it comes to medicine, they are from the stalwarts, leaders, and research people in the field of. We all know the word yoga. Perhaps it is most used, overused, or even misused. Yoga is a very vast subject. It is why the allopathy or a modern medicine is not something to be discarded at all. It is not a bad system of medicine. But what is important to know is the limitations that it has, one. Second is its role, the way it has developed. Third is the enormous amount of billions of dollars of research that it is doing. It is only recently that we find that more and more focus is being given on the preventive aspect of all the diseases. The curative aspect of the disease is the area of focus for allopathy for a very long time. And now on the preventive aspect, a lot more focus has been given. There is a sudden awareness about the exercise in the market. And I call it market because allopathy has, unfortunately, a relationship of monetary benefits involved in all the senses. The role of money in allopathy cannot be zero. But the pharmaceutical companies, the hospitals, and their intention of treating the patient and making the money out of the disease that he has suffered has to have some norms. Those norms are definitely not followed at all the places, resulting into what is called a disease exploitation. Now, more the disease exploitation, whatever modern name may be given to them through the management practices or the different names coming from the management books, the fact remains that what should be done to keep a person healthy has become extremely expensive now. So the choice for the patient of today is to ensure that he doesn't fall sick and go to the doctor. A great amount of saving can happen when somebody invests in his own health, which means health and its care is an essential part of the modern society. Let's take an example of our own country. In our own country, we have 77 million, 7 crore 70 lakh people suffering from diabetes alone. That means every 11th Indian is diabetic. In USA, the so-called progressive nation of the world, who actually introduced us to all the foul food that medically one can claim to be, may it be a burger or may it be whatever the fast food or the junk food or whatever you call it, that country is suffering from 34.2 million Americans are full-fledged diabetic, that is every 10th person. Today, India is only next to China in the development of diabetes in terms of percentage. The recent survey done by WHO has indicated that the chronic diseases are growing at the rate of 58%. United States of America has a better statistic than our country. United States of America is spending $2 trillion every year on health alone. Out of $2 trillion, 75% are spent on chronic conditions. And as an authentic report coming from the largest survey done by none else than US Center for Disease Prevention, and the report says diet, inactivity, and smoking, if these three are taken care of, there will be reduction in the heart attacks by 80%, type 2 diabetes by 80%, and cancer or malignancy by 40%. What it indicates to us is the modern medicine seriously needs to rethink about its own role. No doubt, in emergencies, it has developed itself as one of the best medical systems. But mind well, it is in emergencies. If you have a heart attack, nobody will tell you to do a pranayama. You have to get into the intervention cardiologist's room. Agreed. But the fact remains that the one who is doing yoga will not be in a position where he has to go as this emergency to the medical intervention cardiologist. So how do we find today yoga and medicine? See, yoga and medicine, the relationship has undergone a lot of change over a period of time. There was a time, a little before when I was in medicine, yoga was considered as an alternate system of medicine. Then after that, the second stage came when yoga got accepted into the medical systems, allopathical systems, and it started getting a mention in the medical textbooks also, but it was only recognized as supplementary medicine, mostly in the musculoskeletal disorders. So majority of the orthopedic patients like cervical spondylosis, lumbar spondylosis, and some amount of muscular and ligament issues, yoga was used by even the allopathy as a supplementary medicine. Now, if we see the kind of research that is going on and the resurgence that has come in yoga, incidentally and unfortunately, it is coming up more scientifically in Western world than in our own country. Now yoga is getting recognized as complementary medicine, not as supplementary medicine. But today, as a subject, what we are discussing is to find out that next stage that must arrive earlier than better is yoga must be the main system of medicine and complementary system should be the allopathy system of medicine. 90% of the people should be healthy and 10% are the one who land in emergency should be taking the recourse to the allopathy. So the place of yoga in medicine, in health, is far above. Unfortunately, it is not recognized so for a variety of reasons. Let us see where exactly the allopathy has a problem. The first thing is the approach of allopathy. The allopathy works more or less on resurrection or correction. That is always a debate. Allopathy banks on correcting the situation than resurrecting the situation. You might put a stent into the heart and live little, maybe 5-10 years longer. But that is correcting the situation. Resurrecting the situation would be making the heart so healthy that it will not require stenting. Second problem with the allopathy is, if there is no manifestation, there is no treatment. Right now, all of us who are listening to this particular discourse, if they are actually subjected to the preventive medical test checking allopathically, I will not be surprised if more than half of them are found to be on the side of a situation where they're into the process of developing a heart disease. And I'm not exaggerating. Perhaps I will leave apart from this crowd person like our Guruji. Because of the yoga, he would be having absolute standard tests. That's a different story, but in general. So allopathy is best suited for emergency situation. You are having status asthmaticus. You are gasping for the air. You are suffering from asthma and the asthma has become very severe. Yes, you would require allopathic intervention. A sudden application of oxygen, giving you the steroids, giving you perhaps even an adrenaline shot will definitely make you survive. There is a role for allopathy. But an asthmatic who takes help of the yoga right from the beginning very rarely would land in status asthmaticus. That is the role of yoga. There is another problem with allopathy. Majority of allopathic medicines are abused. We all have heard of superbug. Huge amount of unlimited use of antibiotics has led to a situation where we might come across a situation, mainly in India, that the antibiotics will stop working. No newer antibiotics are coming. Very, very few new antibiotics are being researched. The older ones are becoming resistant to the bacteria. We might land into a situation of superbug. In fact, it is already there at the door. That is one part. So overuse and abuse of drugs in allopathy. And the second is the side effects of the medicine. The medicine sometimes cures your problem that you have, but creates another problem. And there is also drug interaction. These two drugs should not be combined, but they get combined and they're prescribed to us. That means we need to have a system where these things do not happen. Another problem with allopathy is the mind is considered separately and the body is considered separately. We have a psychiatrist and a psychotherapist to look after the psychological problems. And we have medicine, surgery, gynecology, etc., pediatrics, etc., to look after the somatic or the body problems. This approach is not there in yoga. Yoga always takes into account body along with the mind. So it is a psychosomatic based approach, not psychos separately and soma separately. So that is why in allopathy there is compartmentalization. Yoga doesn't believe in that. Another thing is, it is an evidence-based science. The gold standard for allopathy is double-blind trial. So it is evidence-based. So anytime there is a research that is being done, larger the sample size, a conclusion is made, and then it is accepted as a part of medicine. But as new evidences come, the older ones are then discarded. I'll give you an example. You all know there was a time when everybody said, don't breastfeed. Then again, allopathy came and said, please breastfeed. The baby should have the best milk is the breast milk. You remember in our childhood, we were told that remove the tonsil, and now say, don't remove the tonsil. Then they came and said, don't eat fat, cholesterol, and then there is a keto diet. Then there is a role of cholesterol in building the atherosclerotic plaque in the coronary arteries, and now the modern things say that cholesterol may not be so much responsible. Then there is a good cholesterol, then there is a bad cholesterol. I'm not criticizing the research aspect of allopathy. I'm just trying to point out that over a period of time, the changes occur and it completely destabilizes the earlier belief. In yoga, in last few thousand years, nothing had changed. The pranayama has remained same. Nowhere correction has been made in the yoga manuals. And then there is another issue. Allopathy is why it would fall short as a complete system of medicine is, you might be wondering that being a man of allopathy, I'm trying to criticize. It's not a criticism. It's an open evaluation of a system. The diseases themselves are undergoing evolution. We all know pre-1950 or 1900, the commonest diseases that in the medieval India or the medieval world they faced are infective diseases, bacteria, plague. Now we don't hear of plague anymore, but plague was a major killer. Yellow fever was the major killer. Influenza epidemic, the largest one that killed more than 5 crore people. Where are those epidemics now? They're gone. From 1950 onwards till 2000, we came into what is called prosperity diseases, diabetes mellitus, high blood pressure. And now as 2000 is crossed, we are coming to a completely new spectrum of diseases prevalent among the masses. These are called stress-related diseases. Nowadays, you go to any doctor and he will say, yo, you are having stress. And by the way, the doctor himself is also suffering under stress. Stress and psychological disorders are on rise. Obesity is on rise. Majority of diseases that we will be facing in the future are lifestyle diseases. In India itself, World Health Organization has come out with a report which says in India, 5.6 crore, 56 million Indians are depressed. 3.8 crores are suffering from anxiety. Our own survey of India, National Mental Health Survey, says that in 2016, this survey was made, 14% of the population, that means 14 people in 100 people, require psychiatric intervention. Our country has 200,000 suicides every year. A disease of mental disorder, when it requires medical intervention, it is called serious mental illness, SMI. USA itself, in the United States, they have come out with the statistical report that 5.8% population of USA is in serious need of psychiatric intervention. What I'm trying to say is, as days are passing, as different decades are coming, diseases are changing. Now what is going to happen? A disease changes, the treatment changes. The allopathy has to adapt to the new diseases. New treatments, new managements have to be worked out. But look at yoga. In 1900, in 1000 AD, in 400 BC, in 100 BC, in 2022, yoga has remained same and still useful, still applicable, and still without any change in the system. So that is why the traditional system of yoga believes in ahara. Incidentally, today is not the subject of ahara, but a simple statement will tell us ahara is important, because food is the most abused anxiety drug. We all are suffering from absolute overeating, mainly because of the culture of eating outside, and it is completely dominated by the concepts that are arising from the country which itself is suffering from them, and that is the Western world. So food is the most abused anxiety drug, and exercise is the most underutilized antidepressant. That is why ahara has been given a lot of importance in our system. Today, that is not the subject of discussion. So we now move forward towards how yoga looks towards the diseases. The main difference between the modern medicine and the yoga is yoga believes that all diseases are terminal manifestations of a long drawn malfunctioning which is arrested. The disease will not happen. Yoga believes in making the body sound so that it does not land into any kind of abnormality. Forget about the disease. Second presumption of yoga is the body and the mind both together are required for the daily health feeling. Third, yoga believes that arogya is not absence of disease. We all feel that when I am not sick, I am healthy. It is not what yoga believes. Yoga believes that health is a state of mind and body which should be 24/7 enjoyed by the person, which we do not. If you're sitting on a couch and if my back is paining, I am not healthy. If I'm becoming extremely jittery and angry for every small incident, I am not healthy. Yoga defines health as a state of happiness arising out of proper functioning of the body and the mind. The presumption that the yoga has is that the body and mind are connected with intangible, imperceptible, vital essence called prana, which most obvious and manageable manifestation of prana is shwas or breath. So it is the prana that descends through different nadis, the channels. Neither the prana nor the channels are tangible or demonstrable, but their effect is seen through shwasa prashwasa. And that is why by managing the shwasa prashwasa or the breathing, prana can be managed so that a proper flow of prana or the vital force ensures that the body and the mind remains healthy. That is the basics of yoga. And the body, the mind, the breath always works in tandem. If one of that is disturbed, others are automatically disturbed. If body is disturbed, the mind is disturbed. If the mind is disturbed, the body is disturbed. And if both are disturbed, the breath is disturbed. Breath affects and affects the mind. Mind affects and affects the body. So mind inflicts, body suffers. That is why body cannot be made healthy unless mind has been made healthy with the help of respiration. That is why breathing is inextricable part of yoga. Now the question comes commonly to the mind that all the allopathy has been discovered through this dissection, anatomy, physiology, experimentation, laboratory, researches, Nobel Prize, different type of instruments, and then allopathy developed. A commendable feat. What about yoga? What kind of laboratory yoga was developed? What did our ancestors and rishis do to really come out with such a sound system, which did not change even a bit in last so many 5,000 or 4,000 years? And the answer lies in the 29th Sutra of Vibhudipada of Patanjali Maharaj. It was not by trial and errors that the yoga was developed. Yoga was developed by Nabhi Chakre Kaya Vyuha Dhyanam, by using the faculty of concentration at the chakra which is at the Nabhi. The yogi is able to perceive the entire functioning and the structure of the body through his mind. That is how they were able to visualize the relationship between prana, nadi, shwasa, mana, sharira. And then the autonomous nervous system in the body, how prana affects that through shwasa, and how that leads to the working of our vital organs like lungs, kidneys, heart, and brain. So that is why the yogis of yesteryears who came out with the system of yoga visualized it at the height of their concentration in the samadhi avastha. There are 7 scientifically proven benefits of yoga. The statements today which I am making are from most reputed journals and research papers of Western world. Not one single word is being made from my side. The first important advantage of yoga accepted by the modern medicine is yoga increases flexibility. Now, just to give a statistics, by the age of 70, 30% flexibility of the body is lost due to rigidity of tendons and ligaments. Yoga is the only system of exercise which works on the ligaments and tendons. You take out any other system, there is no system working on ligaments so effectively as yoga. Second part, all the exercises that we do, whether it is jogging, running, weightlifting, swimming, cycling, take any exercise. It is either with the upper extremity or with the lower extremity, either the legs, the lower limbs, or the upper limbs. But the container, which is called kaya, from neck to the waist, this is called container, which contains all the vital organs like heart, lungs, intestine, liver, pancreas, everything is inside them. And there is a spine at the back end. No exercise pays attention to that. Now the modern exercises have realized it, and they have started coming out with what is called as the core muscles, the plank position. All these are backdoor entries towards yoga. Yoga directly deals with that. So that is why the beauty of yoga is using your own body as the prop without using any external material. You are given the exercises that every part of the body needs, along with the regulation of respiration to ensure the highest level of oxygen at the cellular level. It is a comprehensive system. Yoga increases strength. This is something which is difficult for us to understand, because the bodybuilders, when they show their huge body, we feel they are very strong. They are strong, but the strength developed by yoga is far more powerful in terms of deliverance of pound per square centimeter. That is because of proper utilization of the energy. By proper breathing in yoga, it has been scientifically accepted now by pulmonologists that yoga increases vital capacity. Vital capacity means whatever air you can take in and then you can breathe out, the total capacity of the lung is called vital capacity. It is the functional volume of lung plus the elasticity. And it has been proved that yoga increases the flexibility, that is elasticity of the lung and the functional volume. That is the reason why an omkar done by a yogi lasts for very long time. A huge amount of air he is able to catch in his lungs. Because it improves the oxygenation capacity, because it is able to deliver the oxygen from outside with enough pressure and with perfect perfusion, with each single breath, all the cells get satisfied with oxygen that they require. Mind well, every cell of the body requires oxygen and glucose. It utilizes oxygen and glucose and creates an energy molecule called ATP, adenosine triphosphate. That is what is called as energy. This energy is created only when sufficient supply of oxygen in sufficient quantity at sufficient pressure is reaching up to the cell. Yoga does that. And because of this, the heart of a yogi or the heart of the person who is doing yoga does not require to really work hard, because the oxygen deliverance mechanism being very powerful, at very few heartbeats, without using much force, the blood circulation can reach with the oxygen sufficient for the cell. So yoga improves heart health. This is demonstrated through researches in allopathy. There has been a proper survey scientifically made with all the statistical tests and double-blind trials, and it has been proved that yoga decreases stress. To give you an example, Shavasana has been experimentally tested in the Western world by many doctors. And it has been found that when a muscle is not working, say when I flex my muscle, the muscle is working. But when I'm sitting, I feel I'm relaxing because I'm sitting. But mind well, the nerves keep giving impulses to the muscles. When you are actually working with the muscle, the impulses are 100%. But when you're not working with when you're not doing any work, the impulses go down, but they do not become zero. It was found in the electrophysical laboratory that in Shavasana is the only asana when the electric impulses generated by the nerves go to zero. That is called complete relaxation. So, yoga has been shown and proved that it decreases stress because the cortisol hormone, which is the hormone responsible for stress. These days, our work style is constantly releasing cortisol in the body. That is the reason why we are suffering from blood pressure. This level of cortisol comes down when yoga is performed. Another recent findings that have come out in West is yoga has been proven to reduce inflammation. Now, this inflammation is something which does not give any symptom, but it is happening on the back end, and then one day it results into a disease. These days, if you have seen any person who comes with an heart attack, immediately the blood is taken to confirm the heart attack. The confirmation is done by finding the what is called as inflammatory markers. There is a marker called C-reactive protein. There is a marker called procalcitonin. There is a marker called creatinine kinase MB. There is a marker called myoglobin M1. And there is also troponin T1 and T2. These are all markers to know how much inflammation is happening in the body. And it was proved that all these markers go down in a person who does yoga. One of the best research that has come out with, and this research has been done in 2009 by a Nobel laureate. This lady found out that those who do regular yoga, there is an increase in the level of human growth hormone, and is also increase in a substance called DHEAS, which means dehydroepiandrosterone sulfate. Now, what is the importance of these two things? These two things are responsible for longevity of life. What it means is, those who perform regular yoga, they live a longer life, not only healthy life, but a longer life. There is also some research going on. The results are not yet out, but role of yoga in Alzheimer's disease. The researches are not yet complete, but there are active researches happening. Unfortunately, all these researches are happening in Western world, not in Eastern world. So now, coming back to keeping the yoga and modern medicine on one side, both of them agree to one point, and that point, which is stressed again and again by all the doctors these days, is every doctor advises to everybody is, please do exercise. Now, there is a direction given by US authority, which is called American Heart Association, that at least 30 minutes of exercise is essential every day, or minimum 150 minutes in a week. This advisory came to us long back by our rishis when they said, Shariram Adyam Khalu Dharma Sadhanam, take care of your body. So that is why a new disease has been formulated now, and the name of the disease is very funny. It is called sitting disease. Simply because of sitting at one place, which is the modern working environment, majority of diseases are getting developed. And this is proved by umpteen number of researches published in Lancet, published in JAMA, published in best of the publications. Individuals who do not engage in physical activity or who have sedentary lifestyle, you will be surprised the researches have been done little better statistically in America. An average American sits for 11 hours. 300,000 deaths are directly ascribable to longer sitting through proper research. 65% of the Americans watch TV every day for more than 2 hours. Now, I need not talk about our own country. We all know how much time they spend watching the TV. That means all of us, because of our lifestyle, are bound to have some disease or the other unless we take care, unless we exercise on a regular basis, unless we do yoga on regular basis. Now, there are many exercises options available. There is jogging, there is running, there is walking, there is brisk walking, there is swimming, there is cycling, and going to the gym, and the gym fees of 5,000 dirhams and 50,000 rupees and 10,000 pounds, everything we see. Clubbing, gymming. But what is an ideal exercise? Each of these exercises have a problem. You keep running, all the marathon runners have a problem with their joint. All the gym goers have a problem with their heart because of the huge bulk that they form. So what is an ideal exercise? An ideal exercise is, it should look after the physical fitness, it should look after the mental fitness, it should be aerobic in nature, it should not cause injuries, it should suit all the ages, including 100-year-old person. It should be very easy to learn. It should not require any machine or instrument. It should be cost-free. It should be done at any place at any appropriate time. It should have a centuries of proven history. It should be evaluated by modern medicine. It should cater to strength, stamina, and flexibility, all the three, because weightlifting creates strength but no stamina. Swimming creates stamina but no strength. And both of them create strength, stamina, but no elasticity or flexibility. The only one which fits into all this that is described now is yoga. That is why yoga is the only ideal exercise that we have. Now the question is yoga an isotonic exercise or an isometric exercise? Now these two words are quite often used in modern medicine. Isotonic means that which involves movement. Now supposing that I take a heavy weight in my hand and I do my hand up and down, this is called isotonic exercise. Why? Because my muscle became long, then became short. So this is called isotonic exercise. And suppose I just took a 10-kilo weight and I'm holding in my hand but not moving. This is called isometric exercise. Majority of the yoga asanas are isometric in nature. Sit in Padmasana. Actually, there is no movement. Yet you are doing exercise. Sit in Vajrasana. Sit in any asana. In fact, while performing an asana, you perform Mayurasana for that matter. You perform an asana, but once the asana is established, there is no movement. Only breathing is happening. So majority of the asanas are isometric in nature. Is yoga aerobic exercise or anaerobic exercise? You'll be surprised the Western world is still trying to find out the exact answer. Yoga is a very surprising exercise for them because all other exercises are either aerobic or anaerobic. What is aerobic? Any exercise that increases heart rate, causes what is called as complete oxidation. There is a cycle called citric acid cycle, but that is a science part of it. Anything that increases the heart rate, these days it is called cardio. All the cardios are aerobic exercises. What is anaerobic exercise? That exercise where there is no complete oxidation, a huge amount of strength is applied and the heart rate doesn't go up. That is called anaerobic exercise. In aerobic exercise, oxygen is utilized to maximum. In anaerobic, it is not. As a result, aerobic exercises release in 1 minute 32 ATPs. 32 ATP means 32 molecules of energy, while anaerobic exercise releases only 2. Now, yoga is which one of these two? Surprisingly, yoga doesn't increase the heart rate, but it is not anaerobic exercise. See, it is aerobic, but it doesn't increase the heart rate. So it is neither aerobic nor anaerobic. Even the Surya Namaskar which we do, it has been found through research that the heart rate of the person performing sun salutation or Surya Namaskar do not go up in the different poses that they do. Between the poses it goes up. So it's a very funny combination of aerobic and anaerobic that you see in this particular thing. In fact, in University of Miami, it has been proved that one Surya Namaskar, if it is done for about 6 minutes, it burns 48 calories. Imagine you're not running, you're not jogging, you're not at a brisk pace, you're not doing what is called HIIT, high intensity interval training, which is a modern fashion. You're not doing anything of that, doing just Surya Namaskar, but a 6-minute Surya Namaskar burns 48 calories. I'm just trying to learn the beauties and the secrets of yoga. From where all this information that I shared with you came? It came from Dr. Dean Ornish, the writer, a prolific doctor, official doctor to Bill Clinton and Barack Obama, who wrote the famous book Reversing the Heart Disease, in which he has put 40 pages on meditation and pranayama. His research papers have been published in Lancet. I spoke from his book. Dr. Marianne Garfinkel, the first lady who proved that yoga is useful for carpal tunnel syndrome, a disease that is common for the computer operators. And she proved that it can be cured by yoga. The third is Dr. David Coulter, an MD medicine doctor, who's researched yoga for 25 years and wrote a book called Anatomy of Hatha Yoga. Even an Indian will be put to a shame looking at the details of the yoga that he has described. through anatomy and the modern medicine. Dr. Sarah Dolognas, she worked on yoga and parasympathetic system. Dr. Paula Pullen, she worked on effect of yoga on inflammatory proteins that we just discussed about these inflammatory proteins. Dr. Elizabeth Blackburn, 2009 Nobel Prize winner, in her research, she found out that yoga increases telomerase activity by 43%, and telomerase is called as immortality enzyme. Those who have higher telomerase, they live longer, and yoga increases it by 43%. I am not saying this. Dr. Elizabeth Blackburn, 2009 Nobel laureate, is talking about it. Dr. John Denninger is a psychiatrist who used yoga and proved that the depression can be reversed through yoga. I have deliberately not taken any Indian names because we have a habit of relying more on whenever anything comes from the West. Professor Dr. Maiken Nedergaard, she was the one who used yoga for disorder of sleep called insomnia. And she found that yoga improves the sleep quality, time required to fall asleep. And that is why in the sleep, all the debris, the memory pattern, the thought pattern is streamlined, and you're fresh the next day to receive more stimuli. So those who suffer from sleep disorders do not complete this work of clearing up the dirt in the brain. And that is why they always work with part of their brain not functioning up to the mark. That is why the efficiency in work goes down. This professor proved that yoga improves the quality of that sleep by actually measuring the longevity of the sleep and the time to fall asleep. And then there is a book called Yoga as Medicine by Timothy McCall, another doctor who really got interested into yoga and then devoted his entire practice later on to use yoga in the medicine. Once this is clear to us, we all know that medicine has its role to play. But medicine, allopathy, has more role to play in emergencies for all those who do not do yoga, all those who do not take care of their health. When they land into some problem, for an emergency, you do require allopathy. Agreed. But the fact that one should not land into any calamity of such kind, one has to do the yoga on a regular basis. The breathing and its relationship with the health has been adequately researched. In fact, slower the breathing, longer the longevity of life. In the animal kingdom, the longest living animal is tortoise because it breathes least. And all ferocious animals like tiger, they live the least. Even a huge animal like elephant lives longer because of its low breath rate. A normal breath rate is anywhere between 13, 14 to about 18. All of us, if we now measure, it will be around maybe 40 or 14 or 15 or 16. Maybe Subhash Guruji may be having less than 10 or less than maybe 8, because the expert yogis have a very low breath rate. Mr. Yogi Swami Rama and the Tibetan monks were studied in Harvard, and it was found out that the breath or the respiratory rate of a yogi can go down to 2 or 1 per minute when they are awake, and can even get suspended when they are in samadhi. Of this, 1 and 2 has already been tested in the labs of Harvard Medical School of Swami Rama himself. That is why the focus of yoga is more on breathing. A small example will prove this. When we breathe in, we are supposed to breathe full. A breath that comes from outside and goes for the sufficient period of time. You're supposed to fill in your lungs. Guruji again and again during the exercise advises, fill in your lungs. We don't do that in a normal way. So normally we breathe 500 ml of air only. Out of 500, 150 gets trapped into the dead space up to the trachea. So only air utilized by us is 350 ml. When we do Agnisar, you will be surprised, this air goes to 1600 ml, 5 times more. So when you are doing Agnisar, we are actually focusing more on the tummy. There is definitely functioning happening there. But the very fact that we are doing Agnisar, that itself increases the quantum of oxygen that is taken in, is increased by 6 times. I am yet to speak about Bhasrika and Kapalabhati. Yoga increases vital capacity, tidal volume, inspiratory reserve volume, expiratory reserve volume. That is why all exercises in the world, when you do that, you get tired at the end of the exercise. I have not seen any exercise, whether running, swimming, jogging, cycling, weightlifting, all exercises make you tired. Yoga is the only exercise when completed, you feel you're floating in the air because you're energetic. What has happened? The body has come out with more energy and oxygen at the cellular level than the spending. That is why even a asana like Sarvangasana, while performing Sarvangasana, the breath that we take makes us possible to inhale 1200 ml of oxygen rather than 300. This air that which goes in ultimately goes at the end of the lungs. There is an organ called alveolus. If it is sprayed over the land, it will cover as much of a football field. That much is the area because it is folded. So it has got a lot of surface area. This alveolus is the place where oxygen and carbon dioxide are exchanged. Now, this exchange is possible if oxygen is coming with sufficient pressure and in sufficient quantity. To give you an example, when you take one breath, 300 ml of oxygen is going at this alveolus with each breath. When we are doing a Kapalabhati, in 1 minute, 18,000 ml of oxygen is brought in. You must have all heard Guruji again and again saying that Kapalabhati charges your batteries. This charging of batteries taking excess of oxygen under sufficient pressure, because in Kapalabhati you're using pressure also to take the air in. So because of the frequent pressure that is put in a minute, the quantum of oxygen that reaches to the alveolar level with sufficient pressure is as high as 16,000 ml. And it's not only the Bhasrika and Kapalabhati that increases the oxygen. All other asanas also do. At the same time, it increases the elasticity of the lung. At the end, lung is nothing else. You must have seen any person who is on the ventilator. There is a bag that is constantly squeezed, or there is an also bag called ambu bag, which we use in anesthesia. It is constantly pressed to put the oxygen under some pressure. That's because lungs are elastic. Yoga increases that elasticity. And there is a very important muscle called diaphragm. There is no exercise available for diaphragm in any system of exercise except yoga, and yoga lengthens the diaphragm. Uddiyana Bandha is the only exercise which increases the length of diaphragm. That is why the one who performs Uddiyana Bandha properly, does Kapalabhati and Bhasrika properly, has pranayama done properly, is the person who breathes perfectly well. So that is why yoga as a system of medicine is not to treat the disease. Yoga as a system of medicine is not to have the disease, one. And it is not the absence of the disease. It is not the absence of the disease. It is the presence of the health that is important. So a yogi, even if he's in the evening at 8 o'clock, 9 o'clock, we have seen our own Guruji, Subhashji, at any time of the day you call him, you don't feel, he's not tired. He's energetic. He can catch the wings of sleep here and there, and yet he's back in action. What makes him so energetic? It is yoga that makes it energetic. Yoga is increasing in its popularity, but yoga's popularity alone is not enough. Doing yoga in the proper manner is important. There are lots and lots of shops that are coming for yoga. It is an unfortunate thing. There has to be a Niswartha Seva like Nikam Guruji to teach this golden science. Yoga is like a diamond. Some people are calling it as a illuminating stone because they don't know the value of it. So that is why today you find popularity of yoga everywhere. 55 million Americans perform yoga. That's not a small number. 5.5 crores. Remember, yoga just doesn't change the way we see the things, but it transforms the person who sees. Yoga not only adds years to your life, but it adds life to your years. Yoga is dance of every cell to the music of breath, creating harmony. Your body normally exists in past and mind in future. Yoga brings both of them in the present. If you can do breathing, you can do yoga. The body benefits from the movement. The mind benefits from the stillness. Yoga gives you both. Yoga doesn't take time. It gives time. And we must all remember, yoga is not a workout. It is working in. I believe I'm able to, in short possible time, put the modern medicine and yoga for a comparison closer and to see the complementarity that can be made out of these two systems. However, yoga is a much wider and comprehensive system. If done properly, it has potential to become the only exercise that every mankind should be doing, irrespective of the religion, the race, the country, the place, because yoga is most secular system of exercise ever available. Hari Om. Om Purnamada Purnamidam Purnat Purnam Udachyate Purnasya Purnamadaya Purnameva Vashishyate. Om Shanti Shanti Shanti. Harihi Om Shri Gurubhyo Namaha. Harihi Om.
Thank you, Dr. Jadhav. It was so fascinating, amazing, so educative, and we got to know different aspect. And you compared yoga with modern science, and you explained how it is the best way of exercising. So, thank you very much for that. Now, I just want to check if anyone has any questions on today's sessions. They can ask now. We'll just wait for a minute, and then if anyone has any questions, we'll take up that.
Can I? Kapil ji, can I start it?
Yes, yes. Santosh ji, please go ahead.
Yeah, thanks, doctor, and thanks to the Vishnu ji and Subhash ji arranging this beautiful, amazing sessions. I have very basic questions. It was regarding, you mentioned about the research about the yoga happening outside India. I suppose this mainly institutionalized research. Our sages, rishis, have developed yoga and Ayurveda through as a people's movement. And now we are just like a global citizens. We have a boundaries, but we move beyond the boundaries very easily. Why can't we do this movement turn into the yoga research movement into the people's movement? Please, can you just shed more light on it, Dr. Ji?
Hariyo, what is required now is that we wait for Western countries to come out with some conclusions, and then we say that yes, yoga is useful for this particular disease or this particular syndrome. What is needed now is to demonstrably prove in the modern manner. See, yoga requires no proving of any kind. Yoga has originated and has proved itself over a period of time. There is no further proof required, but the modern generation, especially of our country as well as majority of other countries, they try to believe faster when it comes through the modern system of research, which believes in statistical trials, double-blind trials, chi-square and other tests. So we need to conduct them. And while conducting them, we should need to follow all these Western standards scrupulously and then come out with so that it gets accepted faster. Now, in our case in India, what happens is we try to get our Shraddha on yoga in the way of research. Anybody just gets up and says that, yes, you can cure cancer. And immediately a modern person asks a question, okay, if that is so, where is the proof? And then we say, no, it has been there. That is not the way to go about it. It is not that we are trying to prove it because it is not proven. No, yoga is already proved. But the reason to reprove it is simply because the acceptance by the modern generation, younger generation will be far better. And for that, one needs to use, unfortunately or fortunately, the methodologies that are acceptable to the Western as well as the Eastern world. And that is why we need institutions like All India Institute of Medical Sciences, postgraduate institutes of different places to take up this as a part of their dissertation study, come out with these researches. Now, it is not that it is not happening, but it is sporadic. Second, we should research it in such a manner that it gets published not in our publications, but it should get published into standard publication where rigorous practices are applied to check and cross-check the findings. Then there will be a respect that yoga will command. Yoga has enormous respect. Unfortunately, we need to re-ascribe it through these methods. That is the only thing. But this is as far as establishing yoga as a best system of health is concerned. But as far as personal aspect is concerned, we do not require any certification from anywhere. It is for you to check by yourself. Once somebody immerses himself in yoga, then he is bound to come out with all the results that are described in the yoga manuals. So there is your own body is the proof. But for the wider acceptance, there are advices given nowadays about exercise. How many people in terms of percentage adopt yoga as an exercise? How many adopt running? How many adopt swimming? How many adopt gyms? People are prepared to pay heavy fees to go to the gymnasium, and under the influence that I have made my body ultimately suffer, because none of those bodybuilders, including Mr. Olympia, very few of them live beyond 80 years of age. Then a completely cost-free yoga gets neglected. And that is because they have not been told properly in proper way about the importance of yoga. In our own country where yoga is born, yoga is not respected to the extent as a standard method of exercise. Thanks to some of the enlightened individuals who came and popularized yoga, but again, that remains only till that level. It should come in as a movement. It should be in the family as a part of the family itself. Yoga should be in every household. And then there will be a healthy India emerging. That is what we need. Hari Om.
Thank you.
Thank you, Dr. Jadhav. I'm just checking if anyone has any question. I have one question, Dr. Jadhav. I mean, I heard you said about mentioning about the other exercises like running, jogging, swimming, or gymming. But you didn't talk about walking or brisk walking. What do you think about the walking aspect of exercise or the brisk walking aspect of the exercise? Is that good or bad, or how that compared to yoga?
Yes.
Is it good or bad?
The exercises which you mentioned, and especially the brisk walk, is considered to be the best and the safest cardiologically advised exercise at the moment. However, have we ever thought that all these exercises, if they also help, and if yoga also helps, then how is it that without leaving the place where I am doing the yoga, that mat, I don't leave even the border of the mat, and these all exercises involve going to a certain distance, how is it that both of them are still called exercise? And the answer lies in the fact, what happens when you do brisk walk? What happens when you run? What happens when you swim? You are breathing. Your breath goes up. So what is happening is, in jogging or running or walking, you are increasing your breathing pattern. Without your knowledge, you are already doing pranayama. While in yoga, the breath itself is taken as the basic step. And the regulation of the breath is used for maintaining and toning the body. So you put the body under exertion and then reach to the stage of breathing, or you regulate the breathing and then put the body under the exertion. Yoga has a completely different approach. It is the only exercise which has a completely different approach. Approach is, do not move away from the mat. Do everything inside the mat. In just 5x5 area, do all the exercise, yet get all the benefits that a runner who has ran 10 kilometers, you will get it. Okay. Now, not comparable, but the results are comparable. It is simply because they work through the same technique of breathing, but that breath is brought in because of the exertion. If there is any exercise that does not bring exertion, but does bring breathing, it is yoga. So, if I do only yoga and don't do anything else, including brisk walk, it is still okay because it is a comprehensive exercise. It gives the same results. Now, if I do brisk walk and yoga, absolutely no problem. You can combine them also. There are people who jog in the morning, do gym in the afternoon, maybe swim in the night. But then you require so much of time. You require your body is in proper condition. You require that your joints, especially of the legs, are in proper shape to go for a brisk walk. You should not be obese, otherwise brisk walk becomes difficult. Repetitive jogging will lead to the usage of cartilage in the joints. In yoga, you may be 120 kilos, still you can attempt. I'm only 40 kilos, you can attempt. I'm 85-year-old, I can attempt yoga. I'm just 15, I can attempt yoga, because there are some exercises not at all allowed for more than 70. Weightlifting cannot be done by an 80-year-old person. A weightlifting for a 10-year-old boy, medicine doesn't allow it. So that is the difference between these exercises and the yoga. So doing yoga alone, and mind well, if a yogi, and I'll give you an actual thing that happened, you might have heard of name Swami Ramatirtha. One of the, he was a yogi as well as a jnani. when he went to America, he used to continuously do his yoga. So his disciples in California, this was very close to Shasta Mountains. One Sunday, all his disciples, American disciples, said, Swamiji, this Sunday there should be no discourse because we are going for marathon. So Swami Ramatirtha asked, what is marathon? They said it is a 42-kilometer run. So he said, sitting alone, what I will do, I will also come. Then they said, Swamiji, it is marathon, it is not easy. You have to be practicing for a very long time. It is 42 kilometers. He said, I will run whatever I can. And you will be surprised. Not only he completed 42 kilometers, he came first, and the second person who followed him took almost 10 minutes more to reach. This is what yoga does.
Okay.
Where was he practicing marathon? The yoga itself is the practice of marathon, because breath is the mainstay. One whose pranas are in absolute fine position, nadi shodhana, the flow in the nadis is proper, respiration is coming properly, the abdominal breathing is happening, constrictive thoracic breathing is not happening, huge amount of tidal volume is developed. Such a person can do any exercise anywhere that he wants. Hari Om.
Thank you, Dr. Jadhav. That was a great example. Yeah. So I'll check if anyone has any other question. Otherwise, we can close the session.
Hari Om.
Yeah, please go on.
Hari Om to Dr. Sanjay ji and Subhash Guruji. To listen to Dr. Sanjay ji is always a pleasure. I think it in allopathy, it is said that like every ill has a pill and every pill has a ill. And similar way, I think you have touched a little bit on the yoga part as well, which is nowadays, I think some people, they are coming from maybe US or somewhere, and they learn from some gurus here in India, and they go back and try to give as like a Kundalini yoga and all. But I believe that should be given under the like proper guidance with the gurus and all. My query with the like in our part, like in India also, like they are like doctors which are like BAMS doctors. And usually they learn about like Ayurvedic thing and again practice in the allopathy thing. And I believe those degrees are also maybe not recognized here. Am I correct on that?
Yes, the reason why most of these DFAM, BASF, BAMS, all of them, unfortunately, they try to practice allopathy because allopathy is most widely accepted system of medicine at all the places, including our country. And that is where what we need to do, we need to understand is this is not a foolproof system. Yes, amongst the existing medical systems available and its practitioners, allopathy happens to be relatively the best. But mind well, allopathy is also a good science in one sense. Allopathy accepts its shortcomings. You will see in all the books of allopathy side effects clearly mentioned. They don't try to hide anything. Second thing is allopathy doesn't claim what it cannot do, which is a good thing. For example, diabetes, allopathy says we have no cure. Asthma, we have no cure. Malignancy, we have no cure. So when it comes to truth, allopathy doesn't deviate from that. However, truthful it may be, fact remains that there are many, many diseases. There are many, many more or so lifestyle and chronic diseases for which there is no answer. How often you are going to give Brufen or naproxen or anti-inflammatory drugs for a lady who is suffering from arthritis? She is 45 when she got arthritis. She is now 80 and she has been eating the pills for 40 years. Is there no way out for this? How long the diabetic will keep on taking the medication? There is nothing that he can do so that can either reduce the medication or stop the medication. And it is possible. Perhaps I can say it with confidence because my own diabetes is now without medication. The reason why it could happen is, of course, the study of diabetes in allopathy is quite in detail, but its utilization, if this has happened because of this way, I must do the opposite way to recorrect it. So preventive aspect of the diseases is most neglected part. In fact, we should be going to the doctor to ask, am I going to be sick in coming 5 years? But people will laugh at this question. We go to the doctor only when, what is the point when the whole cloth is torn? Now you are going to the tailor and asking him, please stitch it. It will be a stitched cloth. So what is important is yoga lets you not only keep the disease at bay, but it ensures that you lead healthy and happy, because happiness is a psychosomatic concept. You can't be happy when your bones are paining. You can't be happy when your head is aching. You can't be happy when your ligaments are giving noise. So that is why yoga gives health and happiness bundled together. Energy, sahaviryam karvavahe, that virya, ojas as we call it. There is a lot of role of all this together. It is a comprehensive system. And as far as those Kundalini yoga, etc. is concerned, that is a travesty of yoga. Today, we only focused on the health aspect, or a little bit of body and little bit of mind in this particular health discussion. The true yoga, the Raja Yoga or Ashtanga Yoga, in true sense, is a very rare phenomena. Any Tom, Dick and Harry cannot just open a shop and start teaching about yoga. Asanas, and to some extent pranayama. Even pranayama itself is such a detailed thing that Patanjali Maharaj has devoted more than 6 sutras. And these sutras have been commented by stalwart commentators like Raja Bhoj, Martanda Vritti, Vijnana Bhikshu, Vyasa Maharshi. They have gone into pages after pages to understand what is exactly. Only the Kumbhak itself has been detailed to such an extent. So that is why we are only touching the tip of iceberg when we talk about this yoga. The yoga is still a very vast thing. Hari Om.
Thank you.
Guruji, hi. This is Sachin here. There's one question from my side. Can you maybe, as per your experience, can you, in this like mobile world, how can we develop interest for yoga in the teenagers, like 12 years to 15 years, 20 years of in that age?
See, there are 2 ways of doing it. One is the boys are under the influence of outside things. There is some stupid hero coming and showing his body, and then naturally he gets attracted to the gymnasium because it is an impressionable age. The most important thing is the children will follow precisely what the elders are doing. So if the father is doing regular yoga, the child in his age may or may not do it, but the sanskar of seeing his father doing yoga will remain and it will continue. That is one part of it. Second part of it is, it has to be participative. For example, a very high truth like, you should always speak truth. You should not be dishonest. Now, these are very lofty principles. How do you teach your child? We do teach. We teach it by some stories, some examples. Similarly, for the child to inculcate the interest in yoga, don't try to tell him that, okay, close your nostril and go for pranayama. Go for simple things. Tell him, can you stretch the leg as much as I stretch? I think your leg gets stretched much more than mine. Try to make it more participative. Because he's a child. He's bound to be wavering. But by doing this, then slowly he will say, Daddy, look, I can even bend myself so much. Look, Daddy, I can touch my feet now. I can bend completely. So bring some amount of a fun element into it rather than serious element into it. 1. 2, if similar age children come together, then they tend to follow in the flock. It is much easier to follow that way. So some camps, if they are being conducted, that always helps. Third thing is, use enticement. It is allowed. So you can always say that if you do yoga, then okay, this is what will happen to you. This will be your reward. Even in our Vedas, Swarga and all that is nothing else but a reward for Chitta Shuddhi. So if the Vedas do it, we can also do it, because anything that is done for good reason, it always pays. So you can use different methodologies to inculcate that interest. Also, tell the stories like the one which I just spoke about, Swami Ramatirtha. Then they start thinking about it, how a yogi can be so powerful. Because in his mind, who is powerful? Arnold Schwarzenegger is powerful. Nobody knows that he has undergone the operation where his heart has been repaired. So we need to talk to them. We don't need to get involved in them. And we ourselves need to do that first. We have no right to talk to anyone, including our child, if we ourselves are not doing it. So yoga, if we have to speak to them, first we should perform and then get himself involved into it. Hari Om.
Thank you. Thanks a lot.
Doctor, I have got a question. It is based on homeopathy. So some say that certain kinds of diseases can be cured by homeopathy and not by allopathy, like certain allergies, like psoriasis or eczema and things like that. So is it true, like homeopathy works, though it takes a longer time, does it take, is it more better than allopathy?
Hari Om. I won't be to give answer on because I have no knowledge of homeopathy at all. I am an allopath, so perhaps in allopathy I can speak with little bit of authority, but homeopathy, Ayurveda, Yuddha, Siddha, Unani, traditional systems of Tibetan medicine, Chinese medicine, I have not much idea about it, because if it is there, if these medicine systems have come, there must be some truth, otherwise they will not survive. But whether to what extent they are true, to what extent it helps, I have really no idea. So I won't be in a position to answer that because I am not a student, even a student of that particular pathy. Hari Om.
Okay, thanks, Doctor. Doctor, I have one question from a few months or maybe year. I read in some books and some research notes that the chakras in our body are actually nerve plexuses, but I'm not sure whether that's true or it's just a myth, or what is the story behind it. What do you think about these chakras?
No, these plexuses that we have, basically if we look at the lower end of the spinal column, there is a part called cauda equina, where you have a kind of a plexus. The nerves are emerging out of it, just like the hair of the tail of a horse. That's why it is called cauda equina. Now the plexuses that we are trying to point out, now these plexuses could be of sympathetic, parasympathetic, that is autonomous nervous system, or this cauda equina. Some people have tried to say that these chakras are only this one. It is not true, because the chakras are visualized in meditation. Prana is visualized in meditation. Now the question is, why visualization only in meditation? Because you require the amount of concentration to visualize what is normally abstract and intangible to be seen as a tangible. Now, have you seen your own buddhi? We will say, no, I have not seen my buddhi, but it is there. You will be surprised. Yogi does concentration or samadhi or sanyam, it is called dhyana dharana samadhi, together on buddhi itself. It is called sananda sampradnyat samadhi. So it is possible, this visualization that we are talking about are the visualization that happen in a state of uplifted consciousness. When buddhi has transcended the boundary of buddhi, has and entered into a thing called pradnya. That is why sampradnyat. When pradnya dawns, then within your own body, you are able to visualize all the chakras. In fact, one of the chakra, which is Manipura chakra near the Nabhisthana, if the yogi focuses on that, with that focusing itself, he comes to know the entire operation of pranas in the body, and he is able to write a complete book on the entire functioning of the body. That is how yoga got developed by these people who in the higher state of consciousness realize the internal structure and functioning of the body, and then they wrote what are these asanas, what is asan, how it is to be performed, how it will help. Otherwise, tell me one thing, those who were in meditation, they always needed what is called as sukhasana or sthira asanam. For this sthira asanam, because once they go into meditation, they would be losing the consciousness of their body. Now, you know that even if you by mistake put your hand under the pillow, it starts paining. Now, imagine the yogi who is sitting in this meditation for 72 hours, 96 hours, maybe a week, maybe a month, maybe a year. and still the body has to function. Otherwise, the body will become stiff. That is where these asanas were developed in order to continue to maintain the flexibility, because yogi cannot afford to have everyday free time for exercise, because his one meditation span may extend few weeks. That is how asana as a part of niyama was given by yama niyama, asana, pratyahara, dharana, dhyana, samadhi. That is how Patanjali Maharaj got asana or this exercise included in the yoga system. Hari Om.
Okay. Yeah. Thank you, Doctor. Is there any more question, or can we close the session for today?
Sir, here is one question from me. Thank you, doctor. You are giving so much valuable knowledge about the yoga. My question is relating with the Surya Namaskara, sun salutations. How it is helpful for weight loss, and how should we practice Surya Namaskara in a day, at minimum and maximum? Thank you.
Hari Om. Surya Namaskar helps us in weight reduction because, as I just mentioned, a University of Miami research, a 6-minute Surya Namaskara is able to consume 48 calories of the body. So that means the calorie consumption, which is called catabolism of the body, increases with Surya Namaskara. That is why if you see, Surya Namaskara also raises the temperature of the body, because the metabolism is at a higher level. 1. 2, because of efficient utilization of metabolism, most of the glucose, which is in the form of glycogen, deposited in the muscles as well as in the liver, is brought into the circulation and utilized by the body. Whenever the muscular part of the body utilizes sufficient amount of glucose, then in such cases, the insulin resistance of the cell goes down and there is efficient use of insulin. As a result of this, you will find the appetite goes down. Mind well, excessive appetite, which is very common in diabetes, is because of non-availability of sugar at cellular level, because insulin fails to function at the cell wall level. Surya Namaskara reverses that. That is the reason why Surya Namaskar helps us in reducing the weight, 1, reducing the appetite, 2, and 3rd, utilizing the existing fat and the glucose, which is in stored form, to be brought into the circulation. So that is how Surya Namaskara is an effective medication or effective system to reduce the weight also. As far as number of Surya Namaskar, how many you can do, that all depends on person to person. And for this, valuable advice from seniors like our Guruji is a must. He would be the right person to tell you, depending upon your current phase, depending upon your current physical capacity, how many Surya Namaskars you can do. There are people who do as many as 100 to 200 at one time. I have seen them, and there are some who cannot do more than 10 to 15 at one time, because every yoga is a practice by continuous doing the same thing over a period of time. The flexibility develops over a period of the time. The tendons relaxes over a period of time. The ligament extends over a period of time. So that is why it varies from person to person. But yes, Surya Namaskar is the most effective way, because in a way, all essential asanas are included in one Surya Namaskar itself. Hari Om.
Thank you, sir. Hari Om.
Thank you, Doctor.